Hello, my name's Adrian Richards. I'm a plastic surgeon and the surgical director of Aurora Clinics. So I'm going to be talking in this short video about possible complications that can occur after brachioplasty or arm lift surgery. And now it's important to be aware that after any type of surgery, things can go wrong or not exactly as planned. In the vast majority of cases, these are relatively minor and no particular concern. It may just be an area of delayed healing or poor scarring, but they're going to resolve naturally with time. Let's just talk through things that can happen really from the beginning. With any operation, obviously, you can get problems with your chest, with your heart, problems from the anaesthetic. These are really, really rare following arm lift surgery, particularly if you're fit and healthy and don't have any heart or lung problems. We use very, very experienced anaesthetists, and there is an awful lot of difference between different anaesthetists, and I would advise you to discuss with your surgeon the anaesthetist they use and the experience of the anaesthetist. Regarding particularly about brachioplasty, the problems you can get are fluid collections, which are seromas, which are just small collections of fluid deep under the skin. But they do occur relatively frequently after arm lift surgery, and these may need to be drained away by your surgeon, but shouldn't cause you too much problem in the long run. Bleeding you can get very, very rare following brachioplasty. That will normally occur in the first 24 hours, and that occurs if a blood vessel opens up again and causes bleeding into the wound, and your surgeon will need to remove that blood clot and stop the bleeding blood vessel. Infection can occur with any surgical procedure. We tend to use the latest theatres with laminar airflow technology, in which the air in the operating theatre is changed very, very rapidly. So any bacteria that might get into the operating theatre are blown away immediately. And I certainly operate in laminar airflow theatres, and since I've insisted on doing that, my infection rates have gone down significantly, and I can't actually remember really in the last 3 or 4 years any patient that has had a significant infection, and I think that is due in part to the laminar airflow system that I operate in. So again, infection should be rare. If you feel you may be getting an infection following surgery, it's very important to contact your surgeon immediately. The signs for infection are increased pain in the area, fever, feeling unwell, and a temperature. After the first couple of weeks, you should be over all of the main risks of bleeding and infection. And then what we really got to worry about then is how the area heals. So it's really about scarring. So we take every measure to support the scar, to discuss what you should massage your scar with to keep it as good as possible. But in some cases, some people do develop hypertrophic scarring, and to find more about hypertrophic scarring, please have a look at the video discussing the difference between hypertrophic and keloid scarring, and the measures you can take to reduce your risk of getting hypertrophic scarring, and if you do, how to treat it. So overall, brachioplasty is a very safe technique with a very low risk of complications, but I would like you to be aware that, as in every surgical procedure, some complications can occur, and it's best to consider these prior to surgery so you can make an informed decision about going ahead with surgery, really looking at the pros, the benefits, and also looking at the cons. So thanks very much for watching this video. We've got lots more videos, podcasts, before and after pictures on our website. Please have a look at these, and we'd love any feedback on the website. And if you would like us to answer a specific query for you, please either email us or send your photograph into us, and I'll be able to give you a frank opinion as to the best treatment for you. Thanks very much for watching.